My name is Malcolm Blowers. I'm 76 years old and I've been in and out of mental health services since 1966. And I would like to impress on you at this time to do your yearly physical health checks like I get. And I also found out by having mine that I had a high sugar content level in my bloodstream. That's put in my mind how well I am by having that every year. And I wish everybody to do the same thing and get a physical mental health check every year.
My name's Claire and I've been under mental health services for about 18 months now. And I was first asked to go for a physical health check through a letter through the post, which I attended last month. And when I arrived, there was very informal, very friendly. It was Kelsey and it was Sally, and there was a doctor there. Very pleasant, very informal. In the actual meeting, they took my weight, they took my blood pressure, they asked me some lifestyle questions. Very important to attend because physical health is directly linked to mental health, and sometimes we don't always look after ourselves physically as well as we do mentally. So physical health is very important and just as important as mental health. They go together. In the actual physical health check, nothing was obviously highlighted, but they did take my weight and I did have a weight issue, so I was overweight. So we discussed lifestyle and I've now, as a result of that, put a nice healthy plan in place. Some healthy eating and some exercise, which I do. So that was a real positive that came out of it. I discussed my weight issues because obviously we don't look after ourselves as well as we normally can do when we're poorly. So that was a real positive. So a healthy mind is a healthy heart. They definitely go together. As I say, I can't stress the importance of them. You can't separate physical health from mental health. They're just as important as one another. So your mental health advisor is there to help you and support you with your mental health, but your physical health is there for your medication, your weight, your lifestyle, your blood pressure and your bloods and anything that it may flag up. So a healthy mind is a healthy heart and a healthy life.
Hello, my name is Katherine Finley. I just want to share a little bit about myself with you. I came into mental health services in 1998 when I was 12 years old, after a traumatic event happened. And I've been on I was on mental health, under child mental health from 12 to 16. Then at 16 I went on to adult mental health, and I'd like to express the importance of like your annual health check and as well as blood work as well, because I've always attended my meds reviews and my blood tests because they are very important and they're not a scary thing to do either. Like it's in like a nice setting with like a doctor and your mental health worker, and it's a good way of discussing your meds and any questions you have about your meds and how they work. Obviously I understand now through doing those how my medications work and why I'm on each one of my medications. And I have had health reviews and annual blood tests, and my last actual annual blood test showed up that the quetiapine, which is an antipsychotic, was sending high QT levels to my heart, which was found pretty quickly thanks to these reviews. And my doctor was then able to lower the dose of my quetiapine, and now it's under control and the levels of the electrical current to my heart are a lot lower now than what they was. I'm not quite sure what it would have led to if I hadn't have had the blood test, whether it could have ended up in a long-term heart problem or not. But I can't stress enough the importance of these meds reviews, because without those meds reviews I wouldn't have known. I'm now able to live normal life, take my meds as usual. I have a certain amount of meds I take in the morning and at night, and the tape did come back positive, the second one, and my ECG that I had at the beginning of January, that came back normal as well. My doctor didn't raise any concerns with me over it, because he normally gives me a telephone call to come into the surgery if there are any issues, and I never got that call, and in fact I got a message to say that my test results was normal. And that's thanks to having the reviews and attending that blood work and stuff that I found out. The physical health check is the reason I found that out. The physical side of it is very important because it can pick up on incidents like that with my heart, and like I wouldn't have known had it not been for that physical health check.
My name is Christy and I work at Coastal Partnership, and I am currently a registered nurse and associate. A SMI health check, physical health check, involves us asking various questions about diet, exercise. We will take a patient's blood pressure, their weight, their height. We will ask questions regarding alcohol, smoking, if there's any substance misuse. We will also look through the patient's records to see if they have any chronic disease such as asthma, COPD, diabetes, and we'll just make sure that patients are all up to date with all their checks. We check if they've had any recent blood tests. If they haven't, we will do a set of blood tests just to check that their bloods are all okay. And then at the end of all that, we'll basically ask the patient if there's anything else that they want to discuss regarding their mental health. So coming to a SMI physical health check, there's nothing scary about it at all. It's literally a one-on-one consultation. If you want to bring a family member with you, you're quite welcome to. A carer can come along, so you don't necessarily have to come along on your own. And it literally just is a few simple questions just to make sure that your physical health is as it should be. So a physical health check lasts approximately 45 minutes. The 45 minutes will include all of the tests that I've just gone through. Sometimes it can be slightly longer if you wish to talk about various other things to do with mental health, but generally about 45 minutes. So an SMI is a severe mental illness. It includes either a current or past diagnosis of schizophrenia, bipolar disorder, and any other psychotic illnesses. So the usual process of getting in touch with a patient to bring them in for an SMI health check is a phone call. If the patient doesn't answer the phone call, that will then be followed up with a letter in the post inviting them in for their check. An annual health check is performed annually, so every 12 months. But if a patient does need to reach out to us before that 12 months, then we are always here and happy to help.